Strokes can be classified into two different kind of broad categories. You have either hemorrhagic stroke or ischemic stroke. So let's talk about ischemic stroke. Ischemic strokes are caused by a blood clot forming in an important blood vessel, which stops the blood flow from getting to a specific area in the brain due to the blood clot. The blood clot blocks the flow of blood, which blocks the oxygen, which causes brain damage. Now, it can form in a bunch of different arteries and veins leading to the brain, and depending on where it forms, you can have very different symptoms. A lack of oxygen to the frontal lobe of the brain causes very different symptoms than a block of oxygen to, say, the occipital lobe, because those two areas of the brain have very different functions, so when the functions stop, they cause very different symptoms. Ischemic strokes are the most common type of stroke. They make up between 65 and 85% of all strokes. They're also the most survivable stroke. They are way easier to treat and have a much higher rate of survival. Now, they're not good. No stroke is good, but if you are to get a stroke, you do want an ischemic stroke. Now, there are multiple risk factors for developing an ischemic stroke, such as unhealthy lifestyle due to diet and smoking and lack of exercise, as well as genetics and increasing age. But most of these risk factors do cause a vasoconstriction, which is a smaller diameter of the blood vessel. So when blood vessels have a smaller diameter, it makes it a lot harder for the blood to get to the brain itself, and when you have a blood clot, the smaller diameter causes the clot not to be able to just pass through like it normally would, causing the blockage.